This is the third in 4 discussions about the impact of COVID on faith communities. And this one is addressing the contribution that faith groups are making to meeting people's welfare and other needs. So we're going to be asking about how the pandemic has affected the relationship between the government and faith communities, particularly local government perhaps and faith communities, and asking what lessons we might draw about that future partnership. We're looking at a very bleak future in terms of the fallout from the pandemic. So how might faith groups be equipped to help deal with that? That does, of course, beg the whole question about whose job is it anyway to do this. So I have 4 guests who I'm going to speak with briefly to kick off our discussion. And then it's over to anyone who wishes to ask questions of them or of each other, to offer comments or share their experience. Could you please use the chat box if you would like to do so, and I will either field your question or come to you directly. Lord Greenhalgh isn't here, as you will have been aware by now, but Chris Baker is, and he is the professor at Goldsmiths University, and he was a co-author of the report Keeping the Faith, which looked at the partnership between faith groups and local authorities during and beyond the pandemic. Chris, I know you might not be with us visually because of your bandwidth, but are you there?
Yes, I'm here, Rosie. Can you hear me?
I can hear you. We will. There's a little bit of delay on the line, so we might have a few silences like that. But first question to you really is: you surveyed local authorities about how they were engaging with faith communities during COVID. What were your key findings from that survey?
The key findings were an increase in activity. So 67% of local authorities that we asked or who contributed to the survey said that there was an increase in partnership working with faith groups. Just to put a bit of context on that, we surveyed all 408 local authorities in the UK, and 194 responded, which is a really high response. So I think that in itself says there's a willingness to have a new conversation about this. 91% of local authorities said their experience of working with faith groups was very positive or mostly positive. The pandemic has clearly created a newfound appreciation and endorsement of faith-based engagement, a recurring motif from local authorities, and we did 50 quantitative interviews to triangulate the survey, said consistently how impressed they were by the professionalism and flexibility of the faith-based response and the resources that faith groups were able to draw upon. So putting some stats on that, 65% of the 194 local authorities we surveyed said they used faith-based resources to transport and deliver food. 60% said they relied on faith-based food banks and food distribution networks. There was lots of interesting stuff around new forms of digital interaction and participation. So digital meetings created flatter hierarchies and created more inclusive processes of discussion and information giving.
It sounds like there's a lot of positive engagement there. Do you see that change in attitude towards faith communities? Do you think that there's been a shift in the sort of relational aspects between faith communities and local authorities?
Yes, I do. And I mean, I've been looking at the policy literature for this for about 20 years now, which is when 2001 is roughly when you can start to discern a growing interest from policy around the role of religion and belief in the public square. And there's one, if you get a chance to look at the report, there's one particular graph which I think is very interesting, which asks local authorities to characterize their experience of working with faith groups. And for example, 88% said that they valued, or their experience of working with faith groups was colored by the ability of faith groups to bring, to add value by their long-standing presence in local communities. 79% that improvement to accessing hard-to-reach groups was a key characteristic of their experience of working with faith groups. 78% referred to the value of local leadership.
Were there any areas of concern about the way faith communities approached their work? Just briefly.
Just briefly. Well, there are traditional ideas associated with faith groups that, for example, they're socially conservative, that they have poor representation of women and children in their meetings, that they want to use, service in the community as an opportunity to proselytize. And in the graph that I'm referring to, the figures that surrounding those attributes of faith groups were extremely low as characterizing the experience of local authorities. So we concluded from that there is a much more relaxed approach generally towards faith groups bringing those dimensions of themselves into the secular public square, if you like. There seems to be much less anxiety around those sorts of things than there would have been, say, 20 years ago or even 10 years ago.
Is there a sense in which COVID is providing an opportunity for government and faith communities to sort of reset their relationship and the terms of their relationship?
Yes, I think so. I mean, the overarching framework of responses that came out of all the data, so that's the survey and the interviews, was clear evidence of a commitment to deepening relationships, a willingness to share resources and innovation, and a commitment to co-developing a more inclusive framework of partnership for future strategy. And the key things that involves, very high percentages of local authorities saying they wanted to work together to raise issues of food justice and poverty with faith groups. They wanted to share best practice in co-production with faith groups. And they wanted to develop safe spaces for honest discussion around religion and belief, so that 83% of local authorities identified that as a priority. And that seems to me that we're moving away from the functionality of delivering care and social welfare to discussing what are the shared values that we need to bring in order to make this partnership more effective. So it's really the shift from technology to values, I'd say, that is the key message of this report.
Thank you. I'm sure people have questions for you later. Could you, Chris, put in the chat box a link perhaps to that report so that people can access it?
Yeah,
we'll go to Tim Mortimer now. If you'd like to unmute yourself, Tim. You're Programme Manager with the Faith and Belief Forum, which is an interfaith charity working with local authorities in delivering and in developing faith policies. Can you give me an example perhaps of a partnership between a local authority and a faith group that have worked together in responding to COVID?
Yeah, sure. I can perhaps give a local example that will chime with some of the stats Chris was just giving. I think in so many cases, like faith and belief groups have been doing brilliant work for a while, but sometimes that's gone unrecognised, and the pandemic's been such an example of an opportunity for people to realise how well faith groups are set up to respond. So we've worked quite closely with Barking and Dagenham local council, and in their COVID response, they put a message out to all community groups to ask which ones could help with the council COVID relief effort. And what they found was that the majority of groups that responded to that call were faith groups. And I think that's for lots of reasons. I think that faith groups often have access to space that can be used as hubs. I think that faith groups have access to lots of vulnerable people and people that statutory bodies might not otherwise be able to access so easily. And they're also already in lots of cases set up to provide welfare services. So in Barking and Dagenham, for example, the Gurdwara Singh Sabha East was already cooking lots of meals for people in the local community, and they were able to ramp that up and cook 4,000 meals every week and distribute them to all the different food banks from different communities in Barking and Dagenham. So I think faith groups were a huge part of that relief effort, but also Barking and Dagenham had been working with us on a faith engagement project for 2 years.
Right, but there's a difference perhaps in the ability of local authorities to respond, depending on whether or not they've already had those strong relationships in the past. I mean, what about the sort of expectations on both sides between a council and a faith group in terms of what they're expecting of each other to deliver and so on? I mean, are you involved with drawing up sort of contracts or faith covenants between local authorities and faith groups so that the the sort of accountability lines are clear?
Yeah, I think accountability lines are clear, relationships and trust building is so important in lots of places. We've talked to a faith group that's maybe not got so much of a positive relationship with a local authority, and it turns out the grievance is something that happened 20 years ago with someone that obviously doesn't work for the council anymore, and it just takes a bit of time to have that conversation to get back to a positive relationship. I think we've been involved in drawing up faith policies that present a kind of positive future picture of how faith engagement could look for a certain borough, how a borough could be more faith friendly. I think it's just important to draw everyone into that conversation. We have this idea of usual suspects sometimes, so there's maybe 2 or 3 faith groups within the community that talk to the council regularly or have the ear of the council, and I think a covenant or agreement is an opportunity to go beyond that and to draw the diversity of faith and belief groups across the borough and people of faith across the borough into that conversation, and that's something that works for everyone.
I suppose it's quite a job, isn't it, for local authorities or the government generally to navigate all the different actors in the field, as it were. But just briefly, if you would, what's the shift, if there is one, in the attitude of central government to enabling local authorities to engage with faith communities? Because, I mean, depending on which government we've got, we've had, people who are paid in local authorities to engage with faith groups, then they're not there anymore, then they bring them back. I mean, where are we at the moment with that picture?
I'd say where we are at the moment is that there is a lack of consistency. So the faith engagement work that happens from borough to borough is very different, and the people that are working on it often have a much broader community engagement role, and depending on how personally passionate about faith they are, more or less work gets done. We also at the moment obviously have the integration agenda, so the government has picked 5 areas where there's a lot more funding available for integration work, which includes work around faith. So that's brilliant. There's lots of work going on in those areas, but then there's a lot less access to funds everywhere else. So if you look back to 2010, under the new Labour government, there was kind of funding in more areas, and it's now kind of more of a patchy picture.
Thank you so much. You mentioned there, Tim, the role of the Gurdwaras in delivering food services. Dr Jagbir Jhutti-Johal is lecturer in Sikh studies at Birmingham University. We had that very visible example, didn't we, Jagbir, of the Gravesend Gurdwara delivering food to the lorry drivers who were stranded on the M20. But we also had a report last week from Gurdwaras, or from Sikh Council UK, about the fall in donations to Gurdwaras, which meant that service might, be under threat. So what would be the role of government in supporting that service, do you think?
Hi. So yes, with the Gurdwaras, there's always been that service provision of langar, the free kitchen. In terms of what the pandemic has shown is that as a result of the fall in footfall into Gurdwaras and the donations, that is having an impact on Gurdwaras' funding stream to support these initiatives. But I don't think Gurdwaras will stop. They will carry on doing this. They've done this before the pandemic, and they will continue to do it afterwards. They will tap into the resources within the local community. I've seen some Gurdwaras who have set up GoFundMe pages to try and raise money for them to do this. Now, government does have a responsibility in supporting Gurdwaras and faith communities that are providing this service to those who are vulnerable within society. But I suppose the government's agenda is going to be focused on looking at it. There will be that organizational clash between the state and the religious players. They're kind of thinking about whether they are providing a service which doesn't have any strings attached to it and everything. And also when we think about it, and maybe this, I'm just thinking aloud, but I don't think government, any of us can put a figure on how much actually we spend on serving those who are vulnerable, whether that is a Salvation Army, or whether it's the Sikh Gurdwaras or whatever. There is a cost that is unaccountable in terms of that service provision. Government will, if they are going to be providing this funding, and I've seen through this pandemic, that funding is done through a kind of that cohesion strategy. If you are working with other partners, other faith groups, then you are able to access that kind of funding. There seems to be that kind of certain barriers have been put up. There doesn't seem to be that trust that these faith communities can do what they've always been doing. And they've always been doing it, and they've been successful at doing it. So there should be that level of trust to say to the faith communities, right, as an individual faith community, you can apply and take the initiative forward. But there seems to be those conditions that you have to be working with other faith groups to get that funding.
But there's also a question of, government is about number crunching, isn't it? It wants to find out, how many people have been fed and who they are and why they needed food. If you've got an open kitchen or language you've got in the Gurdwaras, doesn't it, your principle is that you feed anybody who comes. And some of those are in desperate need of food, and some of them are coming for their lunch to sort of socialise with other people. And does the Gurdwara really want to get into the sort of, well, this person really needed it and this person didn't? And whether does the government really understand why the principle of what faith communities are doing, why they're doing what they're doing in the first place?
I think as faith communities, we're doing it because of kind of that it's social justice. It's that desire to create a fair and socially kind of mobile society through that distribution of wealth and food and everything. And we recognize within our own communities those who are in need and who need support. And if we as faith communities recognize that and are trying to address those issues, then government needs to provide that support network for us when particularly funding does decline. And I think there's a responsibility for government to have that kind of faith and religious literacy, to understand what it is that the faith communities are actually doing through the service that they are providing, i.e. what does Langar actually mean for Sikhs themselves, but also for the wider community in terms of providing a service where actually government has not been able to fulfill through its social welfare mechanism. And we are filling that gap. And to do that, there needs to be that proper recognition of what we're doing, also an engagement with faith leaders and Gurdwaras. So what is it that you're doing? How are you doing it? Who do you see coming in? And I don't think that has been actually done very well to date, for them to get an understanding of actually, yes, we all hear about the word Langar, but what does it mean and how are the Gurdwaras doing it and reaching the vulnerable within society?
Thank you. Do start putting questions that you'd like to ask or comments that you'd like to make into the chat box, because I'll be opening up this discussion shortly. But before I do, I'm just going to go to Laura Marks, who's an interfaith advisor and founder of a couple of interfaith charities. And Laura, you're particularly engaged at the moment with the faith community's role in the vaccine, not simply in opening up a glorious cathedral nave as a centre, but in getting the message out there to various communities that the vaccine is safe and to be trusted. Can you sort of talk a little bit about that, please?
Thank you, and lovely to be here. I think that my role is not specifically on the vaccines, but I think as faith community people, we are all very, very focused on the vaccine. And we're also, I think, very aware that the ethnic minority groups are the ones who are least likely to take it up. They're the ones with the most anxiety. I think that the Royal Society for Public Health did some work recently showing that the BAME groups are least likely to take it up, and there is a lot of anxiety. And this is being fueled. And I think it's probably part of a wider malaise around exclusion and minority groups being left out and discrimination. And I think it's interesting listening to the previous speakers, because there is a lot of coming together. That the pandemic has brought people together in extraordinary ways, but it's also driving division. And I think we shouldn't be naive in thinking that everything is hunky-dory and that we're all getting along beautifully as a result of the pandemic, if only such were the case. I think that there is a lot of great work going on at a local level, at an interfaith level, but there's also a lot of deliberate attempt to drive people apart.
Talk a little bit about that.
I think that the vaccine is a very good example of that, where there are very clearly messages being put out to specific groups, particularly specific faith groups, to encourage them not to take the vaccine. So, for example, the vaccine having pork in it. Well, that is not going to play out well in the Jewish or Muslim communities, or beef in it, or even, even getting even more threatening material from fetuses. That's not going to play out well with anybody, but particularly more conservative religious groups. This stuff is pernicious. A theory about it having microchips in that have been put in there to track us. I was told recently of an imam told me recently himself, actually, that he was asked to put a fatwa on the vaccine. There's a lot of fear and division, specifically driving the minority groups apart. Just looking to see if I had any other ones written down. Yes, there's stuff to do with satanic practices and 666, and that will particularly play out in Christian communities. This is specific stuff. It's specifically driving both fear in the faith communities, but also fears between the faith communities, which is stuff we really don't need.
Well, is the government talking to you about how you address that as an interfaith charity, or how is the interfaith community going to work against that?
Well, actually, it came up recently in, one of the positive sides of all of this is the MHCLG has started doing these very...
Which is, sorry?
Housing and Local Government, which the minister was the Minister for Faith in that department who was coming today. We have raised this, and also with the Minister for Vaccine, I have raised this, that this is something that they actually really need to address at a very high level, because these sorts of rumors spread very rapidly. The internet is alive with rumors and with misinformation, which is very damaging. And I think that government have got to do something about this at a very senior, very central level, and give us really good information, really honest information about the nature of the vaccine. Because if the group of people who are the most likely not to take it anyway are the ones who are being fed the most misinformation, this is going to damage all of us. It's really, really negative stuff. So I think that central government has got to work on it. I think also local government, but I think this sort of messaging has got to come from the top. And so I would really call on government to take this one seriously. Simple messages. We give information on government websites, which is incredibly detailed, but incredibly difficult to absorb. And it may be in 50 different languages, which I think it is. But, what people want to know is there pork in it? Are there microchips in it? And is there some sort of connection with all sorts of awful satanic or other types of theories? You're not necessarily going to want to talk about that directly on TV, but these are really big issues. And I think that we have to not be naive that this stuff doesn't come from nowhere. There are people out there who are using the opportunities of the chaos, the fear, anxiety, the lack of understanding about what's going to happen in the future, the lack of trust in leadership. All of these things are so easily exploited. And I think the faith groups tend to be at the receiving end of a lot of this.
Thank you very much. I note that Hassan Yaudi, I don't know if I pronounced your name properly, Hassan. I think you're Deputy Secretary General at the MCB, Muslim Council of Britain. You've just posted there about the British Islamic Medical Association answering some of those myths. I don't know if you want to say anything about it. Do shout out if you do.
Hi, Rosie.
Hi.
Yeah, I just thought I'd signpost if people haven't already seen, there's been some great work by some of the volunteer doctors and other medical professionals at the British Medical Association, answering some of the common myths that we've certainly been hearing in Muslim community circles, and no doubt they'll be similar to some of what other faith communities have been hearing as well.
Now, Andrew Brown, you've got a question for Laura, I think.
Yeah, no, my question for Laura is terribly simple. Why does she think this is a job for government when the mechanisms of distrust, as it were, are moving through and within faith communities? Surely it's a matter for the networks. It's not even perhaps a matter for faith leaders, because the trust in these things and the communication of misinformation, especially on the internet, works horizontally, not vertically.
And I think it raises all sorts of issues here. I mean, one of the issues is around the internet generally and the amount of hate and misinformation that's out there. And there's work being done on this with the online harms bill. This is something that is, I think, at last being taken seriously. So this isn't entirely about government, but of course the relationship between government and the major internet providers or social media providers is something that's crucial in all of this. I don't think it's just a central government thing. I don't think it's just a local government thing. And I also don't think it's just a faith thing. So yes, there is a lot of faith in, it's the wrong word. People do have a trust their faith leadership, but there's a whole piece here around communication around the vaccine. So I don't think we can say that this just boils down to faith leaders. It's too big of an ask, actually. I think it's a teamwork thing. And I think that the first thing to do is to recognize that we all have a part to play in communication and messaging around the virus and around the vaccine. And the government have a responsibility to ensure that we all get the vaccine. So I don't think we can absolve government from the responsibility, and nor can we give them the whole responsibility.
Thank you. We've got some stuff in the chat about the Sikh Council also hosting a webinar and various things on there. Thank you very much for that. Again, just indicate if you'd like to say something to the whole group. I wonder whether we might just talk a little bit about the faith communities not completely sort of being co-opted into the government's sort of welfare agenda. I mean, how do they sort of maintain an independence? And I wonder, Jenny Sinclair, would I be able to bring you into this discussion? You're from Together for the Common Good. I mean, do you have concerns about the government sort of instrumentalizing faith groups for, for an agenda which really is government's responsibility to make sure that people's basic welfare needs are met?
Yeah, sure. Thanks, Rosie. So I think it's obviously accepting government money comes with a cost, and mission drift is inevitable. It does happen.
Explain to me what you mean by mission drift.
I think it's really important that faith groups and faith-based charities hold on to their sense of ethos, their authentic and distinctive sense of ethos. And inevitably, when we become service providers, there is the risk of, seeking to justify our existence as a useful handmaid of the state. We are able to reach parts that the state can't reach. That's part of our value. But we are more than this. I really think it's important for us to remember we have a sort of sacred civic role. Particularly the churches have been in relationship with neighborhoods for hundreds and hundreds of years. So there's a risk, I think, at the moment of potentially becoming subordinated to the state because we're so useful. And also when churches are in a sort of vulnerable position themselves, many of them facing decline, there is a temptation to want to justify your existence through the provision that you're providing through services. And I'm also very conscious that this relationship of service client, where the churches and the volunteers are kind of finding themselves in relationship with people more in a service provision relationship rather than as neighbours. So I think we've got to think about a shift from that rather paternalistic way of doing good to people and rather towards a participatory role where faith groups are good civic neighbours, but where they retain that autonomy. I mean, as we go forward and face the fallout of this pandemic with rising unemployment, evictions, people defaulting on their mortgages, this is really going to affect our neighbourhoods very deeply. And so churches and other faith groups, I think, need to retain a sense of autonomy. They may have to step up in solidarity with their neighbours and perhaps negotiate with government, local or national. So that sense of understanding who we are, why we do what we do, understanding our own principles, and that needs to go through faith-based institutions like a Stick of Rock, not just in the trustees, but through the chief exec, through all the delivery staff. They need to understand who they are, that they're different, that they have a unique ethos that comes from a deep faith tradition.
I mean, we've been talking about the need, or the government sort of wants things to go forward in a sort of interfaith way. Isn't that a little bit of a problem with the, you know, if we talk about Sticks of Rock, the Sticks of Rock are different, they've got different things going through them. And so you're asking for a whole lot of, if you're wanting to retain the distinctiveness of the faiths in their delivery, and then you're asking them actually all to work together, does that sort of create problems?
It could do, it doesn't have to. We're after a pluralism of a variety of characters. I mean, that's what makes civil society so wonderful, and that's what is important to retain. We don't want everyone to become the same. I mean, clearly we all can sign up to certain principles that the government can set, but equally the government shouldn't subordinate all the faith groups to one, you know, a prescribed set of values. We need to support the distinctiveness of our faith traditions. And I think it is possible to work together for the common good on shared purpose while still retaining distinctive differences.
Thank you. Chris Baker, you'd like to come back in on this?
Thanks, Rosie, and I hope you can see me and hear me. Just coming back really on some of the discussion that Jenny was saying, I think it's interesting that, just picking up on the discussion around vaccinations, that the relatively upbeat tenor of the report that I did and the foundings that I had, interestingly, occurred during the pandemic experience before the vaccinations were really on the horizon. So the data for this report was taken over the summer. And it's just interesting to reflect and observe how the vaccination debate seems to have, paradoxically, as this kind of instrument that's supposed to move us on and save us and move us back to normal, seems to be in danger of undercutting some of the good work and the good relationships and partnerships that are built up during the pandemic. But I suppose the optimist in me thinks that these will survive and they will continue to flourish in the medium to short term, or long term, sorry. The other key to this, I think, moving forward is this idea that my colleague Adam Dillon has talked about before around religious literacy, but he's expanding it to religious and belief literacy. And I think what's emerging from this report and the evidence that it unfolded is a kind of willingness to explore the values that unite us. So it's not so much what people believe, it's how we believe what we believe. And that very much involves also engaging with the great number of people in our society who don't affiliate to a religious tradition, but who nevertheless have a strong sense of beliefs and values that come from religious sources and come from non-religious sources as well. And it seems to me that what part of the agenda or the challenge to the new relationship between local authorities and faith groups is to no longer see faith as something weird or out there or extreme, but something that everybody to some extent has. It's a very natural, normal part of our identities. We're increasingly pluralized and complex in our identities. Increasing numbers of people are no longer 100% secular or 100% religious, but a kind of strange amalgam between the two. And it seems to me that policy needs to work more closely with the grain of what people do, how they live out their beliefs, rather than what they're supposed to believe, if that makes sense. Thank you.
Thank you. I'm going to go to Harry Farley now from the BBC, who's got a question for Laura, and then Rabbi Alex Goldberg. I don't know if you would be willing to come in and share what you've mentioned on the chat. So Harry.
Thank you, Rosie. Yeah, a question for Laura, but if any of the other panelists want to chip in, then go for it. Just picking up on what you were saying about the vaccine disinformation targeting religious minorities, and you were saying how this stuff doesn't come from nowhere, and there are people using this opportunity. I mean, I just wondered whether you can expand on that a little bit. Do we have any evidence of where this is coming from in particular? A lot of the stuff that I've been sent and I've seen comes from either people posing as medics or people posing as religious clerics. Whether that is what they really are, it's very difficult to tell. But do we have any evidence of where this is coming from, of who is looking to exploit this? And if not any evidence, then maybe a hunch?
Well, I have more of a hunch than I have evidence, because I think that we're in a world where misinformation is rampant, and we're also a world where I think the pandemic, as I said before, is an opportunity to drive division. And I think that, I mean, if you look at America, for example, I don't think that all of the civil unrest is because of the pandemic, but I think that the pandemic has allowed more division than otherwise be the case, because there's a climate of fear. So I'm sure that all of the different theories out there, all of the different misinformation isn't all being generated from one source and somebody in a murky basement somewhere. I'm sure that's not the case. I'm sure it's a combination of people and with different motives, but the underlying effect of this is division and generating more fear and more anxiety. And it's interesting, actually, I was talking to a woman the other day who happens to be Hindu, and we were talking in a faith context, but it wasn't a particularly Hindu-based, if you like, piece of misinformation. But she was just saying, well, I don't really think that I would be advocating people taking the vaccine because it hasn't been properly tested. You know, proper vaccines tested over 10 years or so. And as I say, it wasn't that particular case. It wasn't specific to a faith group, but it did really strike me how, and this was a young, highly articulate, highly educated woman. And I thought this is so interesting, you know, that the anxiety and the fear has been spread throughout society. And it is particularly affecting, as we know, the people who are the most vulnerable. You know, the minority groups are the ones who are most suffering in terms of number of deaths and illness. So I think that people of different sorts who aim to divide, I'm sure that some people are putting it out because they're genuinely fearful of the vaccine, but there's too much of it to think that this is nothing, to think that this is just coincidence. It's too pernicious, it's too carefully crafted to just be something that's random. So
thank you. Rabbi Alex Goldberg, you're speaking here about a local resilience forum, which is putting out messages on science, presumably on the vaccine. Just tell us what the local resilience forum is before you make your comments.
Yeah, so I'm Dean of Religious Life at the University of Surrey, leading a team of 22 chaplains from 8 faith traditions. So we get the local authorities knocked on our door because most of the minority faiths are representative or have leadership within the university. So there's a senior faith group which acts with the Resilience Forum. And Rosie, the question you asked us, what is a Resilience Forum? So Surrey County has a population of 1.2 million people. And the Resilience Forum brings together the NHS, the police, the fire brigade, the ambulance service and other local emergency services. And what they did very early on from March onwards was bring together senior faith leaders and then a sort of second tier of faith leaders to try and get messaging right amongst the main faiths in the county. So things around vaccines, as we have a meeting tomorrow about that, things about the fact that your faith tradition or your faith-specific needs are being dealt with in the NHS. There was a concern, for instance, about what would happen if there was a loss of let's get into bodies and how mortuaries would operate under emergencies. You would have seen probably last week in the newspapers there was a Surrey mortuary, a very large one, featured on in the main press. And that was actually worked on in June or July last year in terms of faith needs. And it's continually getting generic top-line public policy messages, which are, save lives, face, hands, wash, whatever it is, and the fact that this is going to be a bumpy time, along with putting in services which are faith-specific. So we're given top-line messages and we make them more Jewish, more Christian, more Muslim, more Hindu. There's also a phone number you can phone at Surrey County Council, but if you say you need bereavement counselling or you need some support counselling, they will put you through to somebody who is Jewish, Muslim, Hindu, or of no faith at all. So that, I think that's the way we keep our autonomy and we keep our independence, whilst working together with those public authorities as a civil society body to try and do our bit, if you like, in what is a pandemic crisis. Some people have said this is akin to a warlike situation. So I think faith communities coming together to try and get that messaging out is important, but doing it in their own way, because we know our communities best, is also vital at this stage. I don't know if I want to add anything more, but I hope that's helpful.
Thank you. Right, have we got any other questions here? Warren, Rabbi Warren Elf, you're in Manchester and working across the boroughs there, I think. How might you sort of engage your interfaith networks in either the dealing with this sort of conspiracy theories around the vaccine or in other areas of responding to the pandemic?
I think there's plenty of work, good work going on, and also plenty of work that's quite necessary for us to get the message out, to share the good work. I think what's Chris's report, Keeping the Faith, clearly shows is the importance of the work that's been going on. The local authorities have recognized the importance of faith groups. Faith groups have been providing some of the services or supplementing some of the services that the local authorities can't produce. In Manchester, we've also been looking at setting up in Greater Manchester with Andy Burnham and the Greater Manchester Combined Authority, a faith either advisory panel or faith equalities partnership, I think we're possibly looking at calling it. And each of the 10 Greater Manchester boroughs is still working independently, their own local stuff, as well as looking more broadly. But I think it's important to make sure that the good work that's going on is emphasized, we get the message out there better. There are clearly opportunities to make it more joined up, because a lot of them, so churches are working, supporting food banks, doing the various things. The Gurdwaras with Langar and sort of other taking food out and feeding. Many of the groups, the mosques, so some of the other groups as well. There's a lot of very positive work going on. But it does need to be a bit more joined up, I think. In terms of just the practicalities, I hear what's being said, that what's there being provided should be funded better from local governments. But at the same time, I think with very little tweaks, we could probably show that this is something supported by faith communities in general, and get them on board. The opportunities, I mean, Laura, I'm sure would hold up Mitzvah Day and Seva Day as opportunities that are clearly there for interfaith work on social action projects together. There's a lot of that good stuff going on, but we can actually improve it on the local level on a more ongoing basis. And I think we need to. I think we need to show government and local authorities that we can be good at this and do this better, which is why I think the importance of the local interfaith networks and groups, and I think the importance of, so as Robert was saying, the local resilience and other forums that are set up for dealing with the crises at the moment, they need to be enforced. But basically, we need to make sure the message from government is out there, but it also needs to be a message from our faith leaders and our faith communities. I've been involved in 2 or 3 areas at least where we've put out a message to say this is safe, this vaccine is safe, we need to get them out. So the British Islamic Medical Association and the MCB have put out is very important. And I know from imams were encouraged last Friday to advocate, and we just need to multiply this and keep it going, because as soon as we've said something positive, there's some jerk who's going to say something negative and try and get it out there on social media, and we need to try again and again and again. And in some ways, we need to make sure we have the support from government, from local authorities, working with faith communities, just to get that out there.
Thank you very much. I don't want to, I'm just wanting to make sure that a couple of other people have an opportunity to say something if they wish. And I don't know, Kashif Shabir, if you want to say anything. If you do, just put your hand up. You're from Muslim Aid, I think. But Bhavinder Singh, you've put in the chat box about the Sikh Council being bombarded with anti-vax messages. Have you been involved in consultations with the government about how to counter those messages?
Hi guys. No, we haven't been in contact with the government regarding this, but it was something that we felt, seeing a lot of the younger generation becoming very conspiracy theorists at the moment within the Punjabi or the Sikh community, which is really affecting the older generation, because they're actually putting their parents or grandparents in danger, I would say, who are making them actually stop taking this by feeding them this misinformation. So I thought it was a responsibility.
Where is the misinformation coming from? Is it coming from within the community or from without?
I think what's happened is a lot of it originally started from external agencies that we've all seen the messages going around about what's in the vaccine. But recently what's happened is there's some, you could say, prominent youth Sikhs who make videos online, who are doing their own research, feeding into this stuff. And just yesterday, I could use an example, just yesterday, on one of our members' Facebook and Instagram pages, we shared a video of a young Sikh doctor, a female and a male, who were working on the front line, just about awareness in Punjabi and English about why it's important for them to, the older generation, to take this vaccine. At the moment, we were bombarded with that organisation. I myself had phone calls about saying that as a faith organisation, we shouldn't be promoting vaccines. We should, and our reply is, then what should we be promoting? We're here to safeguard our communities. We're all part of our faith, and we want to see our congregation grow. It's our wider family, and we're not putting in steps or putting in process to protect them and help them, carry on coming to the God. They're connecting with their faith, connecting with the community. If we're putting them in danger, we can't do that. And I think this is the reason why the webinar was straight away one of the projects we picked up straight away, was seeing all this negative information out there, was to do a webinar regarding the vaccine, because it's important for the community to understand and make a formal decision, not just have this misinformation. And all the information needs to be bilingual as well. If it's not, then we're missing a massive, if we're saying the BME, BAME groups are the most in danger, then the government needs to step up on that and get that information out in all different languages.
Right, I think that's just about it. We've just got a couple of minutes to go, and I want to go back to Ruth Peacock to tell us about what's happening next week on these sessions. But can I just say thank you very much. Thank you, Chris Jagbir, Tim, and forgive me, Laura, for being our special guest today. And thank you all very much for joining.